This is life-threatening.
Yes.
This is life-threatening because it will block the urethra completely and she won't be able to urinate, and it's an excruciating death.
Yes.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue. Okay, so we have got a very special pair here with us today, and this is Baby. Now Baby is about 8 years of age, and I thought I'd take a little bit of time to talk about how we look at and can tell the ages of guinea pigs. Now one of the things we look at are their eyes, and if you look at her eyes you'll notice that there's considerable discoloration around them, and as they age they can get cataracts or a cataract effect, just like we do, which is the silvering that you see inside the eyes. But you'll also notice with her a very slight head tilt, and you'll notice it's tilted to this side, which is indicative of most likely a stroke that she had about 1.5 years, 2 years ago. So she was found flat on her side, and very lucky that she was found that way and then given immediate help, because here she is nearly 2 years on, and the residual effect of that is neurological, but we can see she's got a slight head tilt, and you can also see a little bit of bulging to the left eye. The guinea pigs do get lots of issues that revolve around strokes or trauma that can present in ways like this, but in terms of age it's sort of in line with what we have seen with other guinea pigs, so it can happen. Another thing that we look at is toes and digits, and you can actually see they're starting to curl around. So this, as they're weight bearing over time, their toes start to edge in different directions, and that's another little indicator. Their teeth also give us an indication, but of course without examining them up close we can't see what's occurring there. So with this little girl we're just going to give her a quick check over, and one of the things I'm going to look at is her ear, because inside this ear here she has a considerable amount of build-up. It's really hard and crusty, and that in itself can cause, some issues in terms of fungal. It's a great place for it to harbour, but these girls live inside, so they're really well taken care of in that respect. But build-up like this can also be uncomfortable, and potentially in the right circumstances with dirty cages and so on can become a real problem. So as it is with them living really well, that's not going to be an issue. It's more of a comfort thing. So let's get that cleaned up for her. Sit there. We take a look at your ear. So again, we're just going to use a little bit of Malaseb in water, which helps break down that material. Now what I'm going to do is just lightly with my finger wipe that area, because if you soften it first when it's so hard built up, it will soften it before we start using the Q-tip. If it's oily and wet, you can literally start wiping straight out. This is quite a dry, solid ear. So let's fix that. Starting in front of the ear. Again, never going down the eardrum, which is down this direction, but we simply are going to wipe out, and there's a lot of material there. It's been sitting there. I'm just going to bring that out. Make that ear feel a whole lot better for you. Yeah. With ears you can often get a lot of residual build-up in this lower part of the lobe, and again just going across that section it will wipe it off. You can see it dropping off down here. It just saves it building up. You're a sweetie, aren't you? Yeah, okay. Now that little bit of a reaction is what happens when they have seizures and fits with mites. So these girls have had spray that has been used for a considerable time, but using ivermectin will just clearly get rid of all parasites, which could also, see how this reaction is occurring?
Wow.
Because that could be harboring mites in and around there and be part of the issue. So when we use something like ivermectin or Revolution, it will eradicate
From
that.
the inside.
Yeah, exactly. So what we typically find with sprays is that they're a preventative, but they don't stop them. So that's the difference in them. So we'll put her onto an ivermec, and you should see a big change with that. This behaviour is typical what we see when mites are present. It's almost like a natural scratch reaction, and we see it in seizures when they're having seizures.
No idea that was even built up, being black on black.
I know, it's tricky, isn't it? And because she has a black ear, the colour of this, will naturally be black because it's got skin that is black coloured. It's being removed. So when we have a guinea pig, and with the other piggy we'll see a light coloured ear, but the discharge will be a different colour. Her ears are not as bad as this little girl's particular ear, and it's interesting that the correlation between the head tilt and what's going on with this ear. So again, just checking ears can really make a huge difference. Yeah. We also find with piggies, as they age and as they have problems like limb issues or breaks or bumblefoot, all these sorts of problems that crop up, they then can't groom themselves in a normal way. So this ear is worse than this ear over here. So it may again be something to do with the correlation with the head tilt and when that happened 2 years ago, and her ability to lift that front leg. So almost like a stroke, they're left with residual problems. But by getting her onto an ivermec, it will just completely eradicate any chance of mites. The other thing is that with them being older, they are more immuno-challenged. So their immune systems are a little bit weaker than when they're younger. So if they have anything because mites can come with the hay, they can come with like when they're on the grass, if they're on an area where they just happen to be, that's how they can get them. And if their immunity is down, they're more likely to become susceptible. So we see this often when we have one guinea pig that has a really bad case of mites and not others, because there's an immunity issue with that piggy. Okay, I'm just going to turn you around there. There's a little bit of shade for you. And do this here, which isn't as bad, but still needs to be done. So again, we're just going to wipe these out. I know, you've not had this done, have you? It's okay.
Because even when I have sprayed them, I've actually used rubber gloves, like surgical gloves, and I've put some on the glove and wipe that just around inside the ear, because I figure that is where the mites are. But you know, obviously don't want to spray it really near their eyes.
Do not wipe that in the ear.
No.
Yeah, that's partly what's happening here.
Really.
So we're going to clear this out, and I'll show you what to do with the ivermectin. And yeah, definitely no spraying or putting in the ear.
Not even to wipe it with the finger.
No, because those sprays are actually not meant for the guinea pig. They're actually meant for surfaces. So
it says to spray it onto the rubber,
onto the coat.
Guinea pig.
Yeah, you can put
from
it
a distance
on the coat. Yeah, but not like to put it into the ear.
Okay.
The eardrum goes through to the brain, and it's one of the reasons we have oil in the ear that's a discharge, because anything, it's almost got me. Anything that's that could be parasitic in nature and go in through that area, the oil will stop, and that's why we have it. It's actually a defense of our body. So we have the same thing. Just getting Let's have a look here. Where just going to, I put some gloves on just so we can see that's a tiny little cyst that was there. Let's find it again so we can shave the right spot. Yeah, it's right there. So let's just shave that little bit back. That's it. Just so we can keep an eye on it. Okay, so this is just the tiniest little cyst, and I did manage, she has no weight on her, so it's very hard to get this area on either side, but the whole thing looked like it came out before, which is great. So I'm just gonna, there. Okay, there's a bit more gunge that's come out there. Keep that hair right away so you can see very carefully where it is. Okay, that's cleaned out really well. Okay, and with a little syringe, I'm just going to pop some Debrazole in there. Removes necrotic skin tissue, so skin cells that are dead. That, yeah. Cleaned up for you, little girl. That's better. And that little hole, you can see there's a very neat little hole there. It's completely emptied and we've drained really well. Okay, let's just keep checking you over. These are two little old ladies. So once we get that mite treatment on board, they'll feel a little bit better. The head tilt will definitely improve a little, but you can see that there's something neurological that's occurred with what they've experienced. Now, one other thing is the nasal area has got some discharge, and so has this little eye. So she's also carrying a bit of a respiratory infection, so these girls are going to go onto an antibiotic, and we're organising that now. She's going to, I'll go and get a prescription for these, and hopefully they'll be feeling a lot better in no time at all. So I'm really glad they've popped in to see me today. Been able to give them a little bit of a health check, and I've found a few issues that have needed to be dealt with. Yeah, little girl, you're going to feel so much better. Yes, you are. Good girl, I know. That's the problem. Right. Okay, let's have a look at number 2. Okay, this is the next little girl, and again she's 8 years of age. These girls have been sprayed down with mite spray regularly, and it's been rubbed onto them but also onto and into their ears, which we don't recommend because their ears are so laden with gunge. But we're just going to take a bit of a look, see what we can see. This girl has been in the water bowl earlier, so that dribbling that you can see is from the water bowl. So again, we're just going to soften the contents of the ears. I think you can see, you know, what's occurring there. Take a bit of a look first. It's really important that you clear these ears. They've got it's her right ear is not sobering. These girls have got indications that mites are around, but not quite. So there's no obvious hair loss, but without a doubt, their behaviour and a few things they're exhibiting are showing me signs that I think they're challenged with mites. So just getting this debris out of their ears is the first starting place. Now you'll notice with the guinea pig with white coloured ears, the debris isn't solid black like before. Let's take a look at something like this. That's the debris that was in the ear, really solid and hard. But you'll notice this is more related to the colour of the skin. However, the debris that's in there is what can accumulate fungal, as well as you know, parasites would find it a nice soft place to be, I'd imagine. Lots of ridges and protective areas to be in. When we talk about mites, they're microscopic, and we know that they don't typically live in one area on a guinea pig, but they can start in a location and then migrate out. So it could be possible that they're more up in this region rather than down the base of the guinea pig. So just, and that's not saying this is mites, it's just gunge. But if you've got an area on a guinea pig that's more messy and more mucky, then it just stands to reason that's where they may want to be predominantly. Sarcoptic mange mites, for example, we often find them up around the face and the neck and the chin. It might have something to do with the moisture of that area, but they really do tend to do more damage there. When your guinea pigs are older, they are more prone to challenges because their immunity is not what it once was. So just being mindful that, you know, the extra little bit of mite protection you can give them, the extra bit of warmth at night, it all adds up to their longevity. Okay, a tricky bit in there. I've still got to get that out. Tricky lanky bit. Yeah. There's a section that's right up here where the skin folds, that quite often when they've got a lot of build up, it just tucks itself in there. Just turn it. Yeah. We'll just wipe up around that ridge and it comes out. Part moved it, but when you do, it'll come right out. Good girl. That's a bit better, isn't it? Okay, let's look at that other ear. The camera can see you. There's quite a lot of residual build-up in there as well. So, you know, this hard, scaly, flaky skin, I'll show you what's there. It would be uncomfortable, but this is just perfect for harbouring fungal spores and mites. So just grind. Let's just clear out those ears. We find that when ears are cleaned out, guinea pig's overall health is so much better. So being mindful of that. You can see that behaviour, that scratching that's going on, is typical of what we see with seizures. It's not a seizure, but it shows you it's on the way to that sort of a reaction. And it's interesting that mite sprays have been used here and rubbed into the ears, but don't do that, please. Anyhow, see lots of stuff in there. And it feels so much better. There's that ridge. There we go. Backs of the ears as well. Now this little girl has also got a sebaceous cyst, which is down on the back side of her leg. It's been treated years ago and was last squeezed a few months ago, so we're going to take a quick look at that and see what we can do to improve that. Okay. Look at her little paws again, you'll see they're starting to curl out. This is age-old detail showing. They tend to flatten out and curl sideways. Ooh, actually she has a more serious issue. Now this little girl has a urethral stone, which is right here. You can actually see it. This will need to be removed. It's very painful. You can see her jump as I touch it. I'm so glad they've come in today because this is extremely painful. It blocks, so it's come from the bladder, it's traveled down the ureter, and it's now at the exit point, but it can't get out. So you can actually see how pronounced it is there, like a little bubble. And it's very painful. If I was to touch that, when I've bumped it, she jumps. You can see that clearly on the ear. See how it's on the ear and it's this white crustiness? Just lift that off so it doesn't get to go anywhere else. These girls are kept in really good inside conditions, but because they have grass time, and grass is necessary for guinea pigs. It's natural to their diet. It has enzymes and nutrients that they need. But if conditions are wet or damp on the grass, or, you know, of course there's parasites and so on that they can come into contact with, then they'll cart them back with them. And in this case, there's a bit of fungal on that back of the ear. Hasn't taken hold because their living conditions are so good. But you still need to stay on top of things like this. I'm really glad we had a bit of a look at you, and certainly that the urethral stone would not have been found had I not just picked her up, so we'll have some discussions about that shortly. Okay.